Good morning, viewer. Welcome to our Glory Globe TV as a breaking news. Global mortality rates are falling, but not among youth and young adults, according to the latest global burden of disease study published in the Lancet today and presented at the World Health Summit in Berlin. Additionally, non-communicable diseases now account for nearly two-thirds of the world's total mortality and morbidity, with ischemic heart disease, stroke, and diabetes leading the globe. For the same, researchers also estimate that nearly half of all deaths and disability could be prevented by modifying some of the leading risk factors such as reducing high levels of blood sugar and high body mass index. The rapid growth in the world's aging populations and evolving risk factors have unheralded and a few of global health challenges, said Dr. Christopher Moore, director of the Institute for Health Metrics and Evolution at the University of Washington School of Medicine. And the evidence presented in the Global Burden of Disease study is a wake-up call, urging government and healthcare leaders to respond swiftly and strategically to the disturbing trends that are reshaping public health trends. Dr. Marit's team at IHME and its GBD collaborator network of 16,500 scientists and researchers collected and analyzed data and produced estimates for 375 diseases and injuries and 88 risk factors by age and sex globally, regionally and nationally too, for 204 countries and territories and 660 subnational locations from 1990 to 2023, making the GVD the most comprehensive research quantifying health loss. Over 310,000 total data sources were used for the latest iteration, 30% of them new to this year's study. It includes 1,211 location years of provisional all-age vital registration data, which had not previously been used and which provide more timely information. The global health assessments outlined in three peer-reviewed capstones cover critical areas of the GVT, a demographic analysis, causes of death, and the burden of disease, injuries, and risk factors. Despite population's growth and aging, the 2023 global age standardized mortality rate has declined 67% since 1950, and all countries and territories mark declines. Global life expectancy returned to pre-pandemic levels at 76.3 years for females and 71.5 years for males, which is more than 20 years higher compared to 1950. Despite this progress, stark geographic differences remain, with life expectancy ranging from as high as 83 years in high income regions to as low as 62 years in sub-Saharan Africa. Among adolescents and young adults, the largest increase in deaths was registered among those aged 20 to 39 in high-income North America from 2011 to 2023, mainly due to suicide, drug overdose, and high quantities of alcohol. During the same period, deaths in the 5 to 19 years age group increased in Eastern Europe, high-income North America, and the Caribbean. In the exclusive report.